Good afternoon, dear friends. I'm Natalia, and I welcome you on Allright Dog channel. Most of you at least once experience high blood pressure. Unfortunately, the older we get, the more often we face it. To treat high blood pressure, general practitioners prescribe Amlodipine. For example, a Pfizer medication called Norvasc. This pill relaxes and dilates blood vessels, thereby lowering blood pressure. I foresee the question from you. Alright, dog, to whom it's prescribed and how to take Amlodipine and avoid side effects if they occur. Doses of Amlodipine are from 2.5 to 5 or to 10 milligrams. Elderly patients should start their treatment with low doses, I mean from 2.5 milligrams. Quite often, this dose is sufficient to control blood pressure. In case the expected effect is not achieved, the dose is doubled after 1 or 2 weeks from the start of treatment. For young and middle-aged patients, it's recommended to start Amlodipine therapy with 5 milligrams. As practice shows, quite often, patients simultaneously suffer from chronic coronary heart disease and hypertension. In this situation, the optimal dose is considered 10 milligrams of Amlodipine. However, when taking the medication in a dose of 10 milligrams, side effects may appear. Patient can have feeling of drowsiness, increased chest pain, palpitations, redness of the face and neck. Many patients are worried about swelling that appears on the legs in the area of ankles. And the relevant question from those who face the unpleasant side effects of Amlodipine is how to prevent, avoid, or deal with it. First of all, the side effects of Amlodipine I mentioned are self-limited and in some cases can disappear after 2 weeks of treatment on average. You can also try to reduce the dose of the medication twice. If you have heart pain, put a tablet of nitroglycerin under your tongue. Ankle edema can be eliminated or reduced by replacing Amlodipine with lercanidipine among others, for example with a medication called Zanidip. But the dose of this pill should be twice the dose of Amlodipine you're taking. Another option is to improve circulation of the calf muscles. To achieve this goal, you need to walk more. Better if you would follow the golden rule of 10,000 steps a day. There is also a pretty effective exercise that you should do for 5 minutes 3 times a day. The idea is to roll from heels to toes in a standing position. If you do this super exercise regularly, you can say goodbye to swollen ankles in a short time. But note that if only one leg is swollen while taking Amlodipine, you'd better make an ultrasound of the lower limb vessels. I strongly recommend you to do it. Some patients also complain of early morning dizziness when taking Amlodipine. In this situation, I recommend getting out of bed slowly and sit on the edge of the bed with your legs down for a couple of minutes. And the last question many patients are asking is when it's better to take Amlodipine, in the morning or in the evening. There are numerous studies showing that people who take blood pressure medication in the evening have a 2-fold lower risk of dying of a heart attack or stroke. From my point of view, given the duration of the effect of Amlodipine, as the pill is valid for 24 hours, you can take it anytime convenient for you. What is most importantly is that you take it regularly. And of course, remember that you should always consult your doctor before taking any medications. Stay healthy, dear friends, and see you soon. Yours, Natalia.